Not been to a CAB2 ChatnChew, I want to welcome you. I see some new faces in the crowd and happy for that. The CAB2 is a meeting of the Helen Diller Family Comprehensive Cancer Center Office of Community Engagement. That is an offering that is open to the public. We try to be responsive to what our community partners and those who attend the CAB2 ask us to bring to you. The reason it's called CAB2 is because it's not our primary CAB meeting, which would be CAB1, Community Advisory Board 1. That's our business meeting with our CAB members. But what we wanted to be able to do is bring important information to a broader network, broader community. And so we created the CAB2. And before the pandemic, when we were in person, we would serve lunch and people would come to campus and we'd have a speaker in person. So that's why it's called Chat and Chew. So I do want to continue to encourage people to go ahead and chew again while we chat, because it is lunchtime. The other piece of that CAB2 is that what we expect people, and we hope it will prompt people to remember, is to invite 2 people every time you're invited to a CAB2. And those 2 people, we expect them to invite 2 people so that we can grow the network exponentially and make sure that people get this important information about cancer, cancer control, clinical trials, resources, health-related social needs. We've crossed a number of topics. So again, in response to the comments that we got on the evaluation, which we hope you will all participate in the last 5-10 minutes of the meeting, but in response to what was recommended, which was to bring more non-medical resources for people facing cancer into the space and into people's awareness, we are going to bring to you today the American Cancer Society's supports for people with cancer. We're going to have 2 speakers today, I think sharing the microphone and passing the baton. The first is Myrnelle Gomez, and I'm going to go ahead and pin her so you can all see her. She is someone who has been impacted by cancer on such a personal level that the only way she really knew how to tackle it was to directly fight against it. So she's been an avid volunteer with the American Cancer Society since 2014. That's 10 years. Congratulations on your 10-year anniversary with the organization. And in 2021, she was given the opportunity to join the workforce. And so now she is one of 2 associate directors of Cancer Partnerships, which is a specialized role to impact the entire cancer continuum through engagement with hospital systems across the Bay Area. And together in this essential partnership, she will work to convene, implement evidence-based strategies, share resources, and drive system-level policies and practices to improve the lives of patients with cancer, as well as their families and caregivers. Our second speaker for today, or the speaker joining Myrnelle on the microphone, is Miss Heather Levanduski. I'm going to go ahead and add you to a pin so everybody can see you. And Heather is the Director of Health Equity Cancer Care for the American Cancer Society. And in that role, she focuses on social drivers of health and their impact on barriers to care and health disparities for individuals with cancer. She works closely with cancer centers across the country to create and improve health-related social needs screening and referral workflows and building community resource networks while simultaneously creating a comprehensive social determinants of health workflow development tool. She completed her undergraduate degree in social work at Grand Valley State University, where she received dual master's degrees in social work and public administration. And before joining the health equity team at American Cancer Society, she spent several years in leadership roles focused on care management, navigation, value-based care with cancer centers in her home state of Michigan. Welcome to California. So Heather now remains active in her local community, leading cancer and grief support groups for adults and children. And you may not actually be in California, but I know that we're participating in some of the activities that you're overseeing. So I want to hand the mic over to the both of you. We will share your slides for you if you would like, but you can also share screen yourself, and welcome. And we look forward to what you have to share with us. We'll spend about 20 minutes, 25 minutes of conversation with you guys, and then we'll open it up for Q&A. So go ahead and put questions in the chat. We'll be capturing those questions and trying to feed them to our speakers over the course of the last part of the session. So without further ado, Myrnelle and Heather.
Okay, just waiting for the slides to come up. Thank you so much, Dr. Rhodes and the UCSF team for allowing us to be here to present to you some updates. And again, my name is Myrnelle Gomez, pronounced she, her. I am the Associate Director of Cancer Center Partnerships, specifically in the Bay Area. And I also have a colleague that shares that with me, Eunice Salonga. And so there are quite a few of us in the team, but the two of us are focused primarily in the Bay Area. What I'm going to be talking about is just high-level overview of ACS resources and information for patients, caregivers, and their families. And then I asked Heather to join because she'll be providing an overview of the ACS's Driving Equitable Outcomes by addressing social determinants of health project, including an impact of social determinants of health on screening and intervention in oncology with learnings from the field. And with that, we'll also be asking our UCSF partner, Karen, to join just to chime in on the project that we're working with together. Next slide, please. So here's our agenda. What I'd like to do is focus on some of the services and resources that we get quite a bit of questions on. This includes our call center, some online support programs, our access to care, primarily on lodging and transportation, and then our latest program called ACS Cares, which is a non-clinical navigation program. And then I'll hand it over to Heather, and then Karen will be sharing as well. And then I'll come back to talk about ACS services and resources. As you can imagine, we do have a lot of information and content to share. So should I not be able to get through every single slide, I'm not the type to read every single slide, then I provided it in there for your reference. And then we'll also have more time to spend with you during Q&A. And of course, providing my contact information should you have any questions post-meeting. Next slide. So here at American Cancer Society, our vision is to end cancer as we know it for everyone. Our mission is to improve the lives of people with cancer and their families through advocacy, research, and patient support to ensure everyone has an opportunity to prevent, detect, treat, and survive cancer. Next slide. So our National Cancer Information Center. Think of this as our hub for help. So we have cancer information specialists available 24/7, 7 days a week, 365 days of the year. And they're available through phone number 800-227-2345 or on our website at cancer.org through a live online chat feature. Like I mentioned, we have quite a few things to share and information to navigate through. So what's great about them is they're available to assist anyone, whether they're provider, patient, anyone who has questions about cancer resources. They can help navigate through ACS's website as well as through some national cancer resource and information. So I just put some bullet points there for you, things around prevention and screening, for example, treatment options, cancer information and stats, some pain and symptom management, just the list goes on. So if there's any questions, the great thing I like about them is that they don't put you on a timer. They ask you for some contact information. So should they need to follow up with you, they can do so. And then if anything gets disconnected, they have that contact to be able to reach back out to the person calling. I've tried them before, and I feel like they do have just the ability to provide that support without feeling that you're on a timer. Next slide. Here's some online support communities. So we have our Cancer Survivors Network, which is CSN for short. This is an online community by and for people with cancer and their families. Think of it as a social networking as far as you have a way to discuss, have a discussion board, chat rooms, blogs. You can create a private email address to share personal stories and photos. You can do an online journal, contribute resources, and more. For everything that I'm talking about, there will be links included in that page so that you can take a look at that later and then let me know if there's any questions. The Reach to Recovery website and app, this is specifically for breast cancer. So if a person wants to connect with someone who may be able to understand what they're going through, we connect them with trained volunteers who are breast cancer survivors that can basically kind of talk through them as far as what their treatment process looks like and just the emotional roller coaster that comes with it. So again, we are looking for active volunteers for this space. If there is any questions, these links will be able to provide you with more details as well as reaching out to me. And then the third one is Belong, Beating Cancer Together. This is an app that provides people with cancer and their families kind of a unique and innovative way to, like, a personalized solution to help manage care. There is a forum, and it might be pending at this moment, but if there's any updates, I'll let you know, called American Cancer Society for You. But what it is Belong users can read relevant information that connects them to any cancer resources that it's available on the app. So providing that information as well. Next slide, please. So here's some of the questions, updates that we wanted to talk about around access to care. So around transportation, some of you may be very familiar with this, so this might be an overview. We have Road to Recovery. This is a volunteer-based service. During the pandemic, unfortunately, this was one of the programs that was impacted, but it's resuming in counties across the nation now, and it is active in San Francisco County. It's a new streamlined technology available. Our volunteer drivers are now asked to be COVID-19 vaccinated. They do receive COVID safety trainings, and we are actively recruiting for volunteers because, as you may know, if more volunteers, the more active the service can be in that area, and the more rides we can be able to meet for our cancer patients to their treatment appointments. So we do follow CDC guidance to establish safety protocols for the immunocompromised population. So that does include wearing masks. And then we also ask if people want to have their ride schedules to give some notice. I know it's like a couple of days, but the more notice you have, the more likelihood we'll be able to meet the needs of that ride. So they can call the call center, which I already went over, and then, or they can do the live chat and request for this. There is an app program to schedule a ride, but I'm more familiar with just reaching out to the call center and to the online chat to be able to request for these appointments. There is a link to the Road to Recovery for more information. Of course, you have me. Next slide. Next slide, please. Thank you. So we have our paratransit program. So what this is that if our health system partner, a community partner wants to be able to have paratransit passes, this is awarded by the American Cancer Society to community partners to help cancer patients with transportation barriers and reducing their financial burden. So they get about 100 vouchers at a time. And what the partner is asked to be responsible for is to coordinate and deliver the paratransit passes to their cancer patients, that they be able to help them fill out an application should the transit vendor they're working with need it for eligibility requirements. They help promote the partnership that ACS with ACS, and then at the very end, they submit a final report after all the passes are provided to patients. There's a little bit more detail to this that I can provide via email, so if anyone is interested, let me know and I can send that to you. Next slide. As for lodging, we have been able to renew our partnership with Extended Stay America. And what that is that they're able to provide reduced rate hotel stays for patients with cancer who need treatment away from home. So with a newly designed system, the program will allow patients to be in control of their stay during treatment. Booking for this is done through ACS directly. Reservations are all based on hotel availability, and we do say that patients must be in active treatment and they must reside more than 40 miles away from their cancer treatment center. So I did provide a link there. If there's any questions, let me know. But at this time, we did exceed our free night stay. So this is a discounted rate should people choose to stay at this at these locations. And there's quite a few Extended Stay America that they can choose from. Excuse me. Next slide. Okay, and this is the ACS CARES. This stands for Community Access to Resources, Education, and Support. It equips those facing cancer with curated content, programs, and services to fit their specific cancer journey. What this is that they would download an app, and it would help provide personalized information depending on the cancer that they're dealing with, the situation as it changes as they age, or as new information becomes available. They also have access to our 24/7 call center, and then they have support staff, virtual support from trained ACS community volunteers and in-person support from clinic volunteers. So wanted to highlight this program to you. Again, more information can be provided should you be interested in anything I'm covering. But what I'd like to do now, because I was talking about how these things can interrupt and kind of be a burden on someone who's going through cancer and trying to get through treatment, as far as transportation, lodging, anywhere, any barriers to care. I wanted to bring Heather on to talk about the social determinants of health project that we're working with the UCSF so that she can share a little bit more about what we're doing to tackle this. So Heather?
Thanks, Myrnelle. Hi, everybody. As Dr. Rhodes introduced, my name is Heather Levanduski. I'm the Director of Health Equity for Cancer Care, coming to you from cloudy and rainy Michigan. And I am overseeing a project that the American Cancer Society is working on with support from Bristol Myers Squibb, entitled Driving Equitable Outcomes by Addressing Social Determinants of Health. So for ACS, as we think about all of the programming that we're developing to offer to individuals with cancer across the country and all of the supports that we're offering to partnering health systems, we also want to be aware of barriers and the things that are underlying health disparities. And so one of our major focus areas related to that has been social determinants of health and the relating health-related social needs that stem from those. Next slide. So just to give a little bit of an overview at a basic level of the project that we're engaged in. So ACS has partnered with 6 cancer centers from across the country. Most of them are representative of large urban areas, but we do also have one that is very focused on rural populations and another that stretches over most of their state and has various geographies participating. Our project is for 18 months. We launched in August of 2023. We end on January 31st of 2025. So we are kind of right in the thick of it right now. Participating health systems were provided financial assistance to support them in executing project components. ACS, mostly through myself, but also community impact partners like Myrnelle, are providing technical support as they work through workflow development. We aim to increase knowledge and awareness of social determinant of health concepts through learning communities that I'll dive into a little bit more here in a minute. And we're also hoping to foster community partnerships to provide more responsive resource networks for individuals with cancer in the cancer center communities that we're partnered with. Next slide. So I wanted to level set just a little bit because I'm using the term social determinants of health, and that's what we've titled our project. But really the biggest impact that we have through this project is on what we would call health-related social needs. So if you look at this wheel, you can see that the American Cancer Society has defined social determinants or drivers of health much in the same way that the CDC or the World Health Organization has. And so those 5 domains are education, healthcare, environment, community, and economics. And then we also recognize that health-related social needs are the result of those social determinants or drivers of health. And so you can see examples in the outer wheel there. Where we're really looking to make impact with this project is supporting our partner cancer centers in screening for the health-related social needs and then providing responsive resources to address those needs. A lot of, as I'm sure many of you know, a lot of what is done in the social determinants of health realm is related to advocacy and research and things like that. And those are also components ACS is very much focused on. But for this project, we're very focused on kind of the community or the individual screening of health-related social needs. Next slide. So we have 3 primary project objectives that I'm going to dive into in a little bit more detail. The first is to help our partner health systems to create social determinant of health or health-related social need screening and referral workflows. So some of our participating health systems had workflows that were already well established and we're helping them to refine or improve on those. Others are just implementing workflows for the first time, and so we're helping them to launch those within their health systems. Included in that work is the creation of an action plan where we measure success through SMART goals and the use of a health system assessment that is routinely administered. And we're really hoping to identify sustainable interventions so that this work can be continued post-project. We want to use this 18 months to design workflows that are responsive, meeting the needs of the health system and their communities, and can also be built upon and sustained beyond the end of January 2025. We're also looking to strengthen cross-sector collaboration. And so one of the major ways that we're looking to do that is by cultivating relationships by our participating health systems and their local community partners. And so it's important for the health systems to have a good understanding of the needs, the social determinant of health or health-related social needs of the people that they serve, as well as be aware of the resources and resource gaps within their communities, and to work to bridge those gaps through this project. We're working to develop, we have worked to develop a learning community as well, which allows all of our partner health systems to come together every other month to learn from each other through case studies, through sharing of opportunities and barriers within their practice. And we also bring in subject matter experts who can talk to us about the latest research in social determinants of health, who can talk about systemic drivers of social determinants of health, who can talk about best practices, and who can talk about how we partner with our communities. Again, so that we can increase and sustain the knowledge within these health systems beyond the end of our project period. And then finally, I am working along with our partner health systems and the wonderful insight they've provided us to develop some new social determinant of health screening tools and resources within the American Cancer Society. So our hope and our goal is through this experience, along with some other cohorts that we're working to launch in 2024, we can develop a really comprehensive workflow and screening guide that can be used by health systems in the future as they work to launch this work within their respective communities. So we recognize the importance of doing this and doing it intentionally and doing it well. And this tool is intended to guide health systems who have not engaged in this work yet through kind of that groundbreaking work of starting to build this into their infrastructure and again, build it in a sustainable way. Next slide. So I wanted to give just a little bit of the successes that we're celebrating in our project thus far, and I'll comment on a few more learnings as well. So since our project launched in August of 2023, we have screened through our 6 health systems over 20,000 individuals, unique individuals, for health-related social needs. It's been a total of over 30,000 screenings administered, because some people, of course, are screened more than once. And that's resulted in 5,000 referrals to external resources. Our top health-related social needs reported across the board in 5 out of our 6 health systems was transportation, followed by finances, food, and housing. I'm sure that comes as no surprise to any of you, but just kind of confirming what perhaps many of us know in terms of the greatest needs facing individuals with cancer in these realms. We have learned a lot thus far in the project. We're excited to continue to learn more. We've learned a lot related to the variability of screening tools that exist. We've learned a lot related to the technology needs that are emerging and that are needed to support this work. We've learned a lot about the ways to respectfully partner with communities to ensure that we are not burdening community-based organization partners, but are creating responsive workflows for themselves as well as our health systems to better serve people in the communities that we're serving. And we've also learned a lot about how we can influence or impact clinical outcomes through the screening of social determinants or health-related social needs. So eager to hear your questions. I will drop my email into the chat as well. Would love to dialogue more if there's specific questions for me. But then also want to turn over to, next slide is great. Also want to turn over briefly to Karen Stronach, who's been a wonderful partner for us here at ACS. And she represents a lot of the great work being done in this space for this project with UCSF, just to provide an example of how the project is being executed within one of the health systems. So Karen, thanks so much for joining. I'll turn over to you, and then I know Myrnelle is going to wrap us up as soon as you're done with a couple other resources.
Yes, well, thank you so much. It's been such a pleasure to work with Myrnelle and Heather, and such a great learning process. Next slide, please. So just to give a little background and context, in March of 2023, UCSF rolled out the key SDOH questions related to financial strain, food insecurity, transportation, and housing insecurity. This is part of a national mandate that hospitals address SDOH needs. And the way these are captured is within APEX. There is an APEX SDOH screening wheel where if patients respond to these survey questions affirmatively, it's highlighted. So for example, this patient responded that they have housing needs, financial needs, and they also smoke. This SDOH survey is sent to all new patients at UCSF through MyChart annually, and then to all new patients, and then annually thereafter to existing patients. When we found out that this was happening at the Cancer Center, we realized that we're asking patients these questions, but they're not necessarily addressing their needs. We don't have a workflow set up. There are, of course, many ways that social workers do reach out to patients with these needs, but we didn't have a direct way to address the SDOH survey questions that were rolled out. And just around this time, very fortuitously, I found out about the American Cancer Society grant for $75,000, which allowed us to hire a new patient navigator who can carry out the workflow. Next slide, please. And we had to decide now within the Cancer Center how to develop this workflow, how to make the best use of this patient navigator, a connector to help her connect patients to resources, how to interact with social work, the nurse clinical navigators. And so we decided to start it at a site that is self-contained, that serves many different types of cancer, where other SDOH questions weren't being asked, because in other departments, sometimes we do ask SDOH questions. And we settled on the Berkeley Outpatient Center. And we have a great team in place, which includes social work, IT, patient navigator, nurse educators, and leadership. And of course, we're partnering with Office of Community Engagement with Dr. Kim Rhodes and Michelle Mosley, who've been really instrumental in helping us set up the grant and helping us providing the resources to connect to community organizations. And I hope that in this next phase, we'll be able to make better use of that. We have Amy Alanis from the Women's Cancer Resource Center, who's been participating in some of our meetings, and of course, working closely with ACS and learning from them. And the goal of this project is really to learn and design an effective, efficient workflow that we can scale to other departments to discover the kinks and figure out reimbursement codes. There are now new payment methods that can reimburse for referral work. So this is all a learning opportunity for us. Next slide, please. One thing that another team that we're working very closely with is the UCSF Social Drivers of Health team. This is the team that rolled out the survey, and they have partnered with a platform called Find Help, formerly Aunt Bertha, that has thousands and thousands of community-based organizations. What is really great about this platform is that it is customizable. So we can customize it to UCSF, favorite our community partners. We can also create favorite folders within departments so that we can send out resources that are specific, say, to ovarian cancer and transportation. And patients can pull that information themselves to get by putting in their zip code and putting in a search. And make updates as needed if there's a resource that needs to be added or is incorrect. Any staff person or patient can submit that to Find Help. So far, our progress, we've hired a new patient navigator, Audrey Connell, and the process so far that we've put in place is she is responding to all the patients who respond affirmatively to the SDOH survey with a generalized email with resources to the Find Health platform and some of the Cancer Center programs, and asking them if they would like help accessing additional resources or receive a more tailored list of resources. And then she'll be contacting those patients, following up with them, and also asking them to provide feedback about the resources that were provided so that we can better tailor our referrals. And the other thing that she will be doing is reaching out to patients who do not receive the survey through MyChart, patients who probably are less tech savvy and have the greatest SDOH needs. And so she'll be reaching out to patients with Medi-Cal insurance who don't have access to MyChart to administer the SDOH survey, and our medical assistants are also going to be doing that in clinic to those who don't respond. So our hope is really to capture, identify the patients who need SDOH resources and better connect them, and to scale it to other departments. Next slide. And I think this is back to you, Myrnelle.
Great. Thank you, Heather and Karen, for adding that information. What I'd like to do is just, I know we're coming at close to time, but providing some additional resources and information. So here, the additional online support I wanted to highlight is our caregiver and family support. You would find interactive caregiver resource guide, caregiver support video series, some how-to guidelines on being able to take care of yourself as a caregiver and being supportive to somebody with cancer. The American Cancer Society also has our books. We create and publish books to help people navigate the cancer experience. Some of these include cookbooks, expanded stories as far as people living through the cancer journey. So if you're interested in that, the bookstore is a great way to get some additional resources for you. And then our link to understanding health insurance. This covers things like health insurance options, health insurance laws, managing a person's health insurance and their costs for cancer treatment, and even finding and paying for treatment. Okay, next slide. Some additional support pages, survivorship support. This is about living well during treatment, coping with cancer, the concern about reoccurrence, just more focusing on managing care when dealing with cancer. The additional languages, I wanted to highlight this because when you click on this page and you click on the actual language, it'll provide resources that are already translated in that language. So we have an array for you to choose from. If there's something in there that you had questions about, or you're even interested in receiving additional resources in a translated language, just let me know. I know that this is a costly thing to do, but we do connect with external organizations as well to see if we can share resources. So if there's something there that you can also share with me, that would be a great way for us to create a more robust resource guide. And then our treatment and survivorship, this is around just understanding the different cancer types, the different cancer treatments, the diagnosis of a person, treatments and side effects associated with that diagnosis, and other kind of miscellaneous information there. And again, providing links to each of these for you. Next slide. Our personal health manager. So some of you, if you're like me and you want to be able to have hard copies when you go to your doctor visits or try to manage your care, there's things that you can do to print out and kind of jot down some notes. Things like how your medications, the appointments, questions you want to ask your provider. So we provided this so that people can go into this, they can take what works and leave the rest if they wanted to. They could bring these hard copies to their appointments to help track their progress. Next slide. We have a patient legal handbook. ACS was provided a grant funding to assist with the creation of this handbook. Right now, it's currently only available in English and Spanish. It can be downloaded for easier and quicker access, or you can actually order a copy if you need to. This covers things around work, health coverage, finances, end-of-life issues, as well as some miscellaneous things around caregivers and concerns and benefits for non-US citizens. Next slide. Tender Loving Care, this is a website that offers a variety of affordable products to help with the appearance-related side effects of cancer treatment. It's not just wigs and scarves. There are things like other mastectomy products. And then we have a generous return policy as well as insurance coverage information on the site should the insurance be able to cover some or all of that cost. If you want to request a free catalog, you can call this number or just go to the website, and then you can be able to sift through the different varieties. I know I'm going through this quite kind of fast, so again, just providing some resources for you, and then of course can address questions soon. Next slide. And then these are the updated flyers with QR codes. So what we did discuss here at ACS, you can request for either a 1-pager or a 2-pager flyer. It has QR codes, so if you have it posted in your office or in your lobby area, patients can actually scan the QR code and go directly to that page. And you don't have to have any heavy booklets or any kind of several different flyers to cover this information. The 1-pager talks about the ACS Cares. The 2-pager provides the 24/7 cancer helpline, which I talked about earlier. Next slide. And this is just some local and virtual opportunities. Our sister organization, which is ACS Cancer, stands for Cancer Action Network. They help us, and together they're fighting cancer as a top priority in Congress and in every state legislator across the nation to help secure federal funding for life-saving cancer research to ensuring every American has access to cancer screening and care, because our work is saving more lives. If you want more information about this program or this organization, I provided their link, and you can also become a member. We always want to be able to boost our membership. And then some events, Making Strides Against Breast Cancer is the largest network of breast cancer events in the nation. And then Relay for Life, one of the largest peer-to-peer fundraising events to raise funds for a future free from cancer. Each of these links goes to the event page. You put your zip code in, it'll show you what events are nearby. If there are additional events, I'll let you know, or you can contact me. I am your main point of contact. And then our last slide is our contact. And I'll put that also in the chat. And then, of course, opening it up for questions. Thank you all so much for the time today. Thank you, Karen and Heather and Dr. Rhodes. We are here for addressing questions now. So handing it back over to you.
All right, so we're going to take the slides away. We will share the slides out to everybody, and this session is being recorded. It'll be available on our OCE, Office of Community Engagement website on the Cancer Center's homepage, or actually on our homepage on the Cancer Center. So we do have some questions in the chat. I know that you did answer already in the chat for Jill regarding the paratransit passes. But I'm just wondering if you can just say that out loud for everyone. And the question really was, how would a center access the option to see about eligibility for transit passes?
Okay, so there's actually, these are great questions, and I provided my email as well. So I do have a separate email that covers this information to be considered for the program. I'm just reading a little bit of the blurb from the email. There's a partner form that I would attach, and then once reviewed and okayed, we can purchase the vouchers and get them sent over. The report requested, it would just be amazing to see where how these patients are receiving the support and where it's going. So there is no criteria that a patient needs to meet other than a cancer diagnosis to utilize this service. And so again, the requirements would really be on the local transit agency that's receiving the application. So that's why we asked for the partner who's receiving the vouchers to support the patients in the application process. And I could share this information as well. There's a little bit of a process to it, but yes, it is possible to get these requested.
Great, thank you so much. We have a question from Gary and one from Michael that I think are kind of related and is about diversity in care providers. And so one is a question about what percentage of your providers include Black and Brown providers, and then what percentage of your engagement activities are men versus women. Do you find that you're engaging more men than women, or the other way around, and are you doing anything to make sure that you're reaching men? Because I know that's always in Michael's question.
Well, go ahead.
Oh, go ahead.
Heather,
I'll comment. Yeah, I'll comment. I saw the question in the chat, and I wanted to comment just briefly, specifically to the social determinant of health project that we're engaged in. And first, to acknowledge what an important question it is, and how one of the focuses of our project, one of the learning communities that we're focusing on, the resources we're providing through our guide, focus quite a bit on cultural humility as we screen individuals for health-related social needs, especially in light of the fact that we know that in our screened individuals with cancer in 2023, 25% identified as Hispanic or Latino and 10% identified as Black or African American. So we certainly recognize the need for, again, cultural humility in screening. Within the project, within the Social Determinants of Health project, we do not, through our IRB, have any specific reported demographics related to provider demographics. And so those aren't numbers that I'm able to report out on for the grant. But again, want to just acknowledge and affirm the importance of diversity and representation in those that are doing the screening.
Great, and looks like there's some activity going on in the chat where Myrnelle is responding. I just want to make sure that if you're responding in the chat, there might be some people who are not reading the chat. So I want to make sure that those questions and responses get out to everyone. Karen, this is I think a question for you. Can you provide some examples of the social determinants of health screening questions? And I was kind of curious why smoking is considered a social determinant of health and how that question got in.
Yeah, so we had some questions in the past that were asked regularly of patients about smoking and alcohol use. And I'm not exactly sure why the SDOH questions were added to those questions in the wheel. So I think that's just an artifact of how they were added. If you want, I could just share my screen momentarily and you could see the questions exactly. And so then everybody could see it. Just 1 second. Here we go.
Sure. As you're sharing screen, Heather, did you have something to add to what Karen just said? And then we'll go back to you, Karen, with the questions.
Yeah, I want to just comment on the fact that I mentioned during my presentation that there's been a lot of learning that we've had at ACS about the tools that are used in health-related social need or social determinant of health screening. I can tell you within our participating health centers, 4 are using the EPIC screening tool. 2 are using the NCCN distress thermometer and problem list. And so both of those capture domains that we would not typically assign to the realm of health-related social needs. So those are a little bit, they're intended to be used perhaps a little bit differently, or they cover things that are not within those technical definitions. The standardized tools for health-related social needs screening, like Prepare or the AHC through CMS, tools do not seem to have as much traction in oncology. They're used a little bit more frequently in primary care. But if you're looking for tools related to this type of screening that are a little bit more validated and also a little bit more specific to what is traditionally thought of social determinants of health or health-related social needs, typically you would be using or looking at one of those tools.
Yeah.
Great. Would you mind, while Karen's talking, could you just put those in the chat and we'll capture those and include them in the send out?
I will do that. Thank you.
Yeah, so here's just an example of the SDOH questions that go out. Again, these are validated and based on kind of national standards. How hard is it for you to pay for the very basics like food, housing, medical care, and heating? And you can see that there are, different, you could say it goes from very hard to not hard at all, or they refuse to answer. Food insecurity within the past 12 months, were you worried that your food would run out before you got money to buy more? Never true, to often true, or patient refused. Within the past 12 months, the food you bought just didn't last and you didn't have the money to get more. The scale is never true to often true. And then transportation needs in the past 12 months. Has lack of transportation kept you from medical appointments or from getting medications? And then there's another transportation question. In the past 12 months, has lack of transportation kept you from meetings, work, or from getting to things needed for daily living? And here you can see what it looks like on the other side. There may have been some updates since June. I'm just pulling up the thing that I had most easily available. And, these can be changed. They're not set in stone. But these are the ones that patients are responding to. Again, there may be a few changes since June.
Great, thank you for that. And so is that share? I don't know if that's shareable, like the set of questions.
I'll make sure to share them with you so that you can share them later. And just to say that we have a very diverse population at UCSF. I don't think that people realize that about a quarter of our patients are Medi-Cal patients. And so these SDOH questions are really relevant and touch a lot of our patients.
Indeed. A lot of everybody's patients, honestly.
Yeah.
Okay, so I'm curious what you all do for people who have technical needs, because I heard that term technical needs, and I'm just wondering, so how do you end up addressing that? Because if you don't have the tech, you can't download an app, and then you can't use some of the services. So how do you get around that?
I think that's such an important question and a huge issue. In our small pilot, we have the benefit of hiring our patient navigator. So she will be reaching out to the patients who do not receive the survey through MyChart, who are not using MyChart. However, I think that's a really important question for us to address as a hospital as we scale this to other departments where they won't have this patient navigator, because my concern is that the tool that we're using actually is going to collect this data and identify the patients in greater need, may exclude the very patients with the greatest needs because they're not on my chart. So certainly one of the ways we're addressing it at the Berkeley Outpatient Clinic is that we are making sure that patients who have not responded to the question have the medical assistants ask them these questions. So that could be one way to do it. But I think it's a really big challenge and an important one for us to put in a lot of thought into and to try and address.
Yeah, especially since a lot of the American Cancer Society resources are actually kind of digital. I'm just going to take a second to say the link for the evaluation is about to get put into the chat. So when you see it, please click it, please fill it out. We do want to get your feedback and find out what you want to hear next, but we still got 10 minutes. So I've got some questions on the American Cancer Society side. There was a question was in the chat. I think it got answered. Do the centers and chat provide services in the same languages as the website?
This is a great question, and I did provide my email address, so some of you are probably receiving responses from me since I might not have all the answers to the questions during this meeting. So with the call center, I know that when I've connected with them, they did provide translated services depending on the language that's requested. I don't know if all of those languages listed are provided. That's why we wanted to create a space to have handouts and things like that to be printed so people have that in their preferred language. So I would definitely take a look at that and then follow up with this person with their question to see how the call center is able to support different language requests.
Great. So so basically we don't know. And there may be languages that they might, there are some rare ones that are definitely spoken in the Alameda County area that, maybe they wouldn't have, like mom, for example, some of the indigenous languages.
Right. There's a diverse base as far as what we have available. But I don't have all the languages listed. So I think the question was, is it available in the languages provided? And so I wanted to get clarification for that before I provide a direct answer.
Great. So we'll follow up with you on that.
Of course. Yes,
a question for Karen is, where are the evaluation questions located within the UCSF MyChart? Because we do have some folks on the call who have a MyChart account at UCSF. Is there a place to find them, or is it just getting mailed? How is it? What is the workflow that would make sure that everybody kind of gets that? Or is that not the goal?
Such an excellent question. Right now, patients can't actually pull those questions themselves. It's something that I have brought up with the team, because if we're going to be sending out the survey once a year, let's say somebody's just gotten diagnosed, they receive the survey, they're in good financial shape, but then they've been sick for 3 months and not been able to work, their financial situation may change. And so I think it'll be really great if patients can not only be pushed out the survey, but then could pull the survey when their needs change, because their needs aren't going to be aligned with when we send out the survey, right, once a year.
Right.
So I think it's a really good point. Patients right now can't pull this, but it just automatically goes out to every new patient and patients annually thereafter. There is a way to look in MyChart if you are a provider, so to look in Apex to find these survey questions, but it's not something that patients could find themselves.
Could initiate themselves. Great. Okay. And then for the American Cancer Society, another question about what specific programs do you have for promoting diversity in clinical trials? Or do you have any programming like?
That's another question that I'm going to have to be following up on. I don't actually work in the clinical trials, but what I did is provide a page or a link to the clinical trials on our cancer.org website. And then I'm going to have to check in to see how we're able to increase diversity in the programs.
Great. So we'll follow up with you on that as well. All right, great. And then for Karen, is Find Help available in various languages or just in English?
Yes, it is available in many languages. When you go to their site, there is a way to do a drop down and translate it into the language you want. Also, the survey does go out in all core languages. So that is available in many languages. And again, we hope to develop more resources also at UCSF for our limited English proficiency patient and make sure to highlight those in the Find Help database.
Great. And are you going to be able to tailor the Find Help database so it includes resources that might be around this on this call, for example?
Yes, that's what's, I think, so exciting. There is a Find Help community monthly meeting, and I really want to leverage the organizations within CAB for Find Help so that those community organizations come up first again. So that's going to be a process of developing that, and I really look forward to collaborating with Office of Community Engagement and its CAB partners.
Excellent. And I see that Heather put a link in the chat. Do you want to say something about that link?
Yeah, so I know this doesn't completely get at the question that was asked, and I know that Myrnelle is going to circle back with some updated resources related to how we support individuals from diverse backgrounds in accessing clinical trials. That's a really broad body of work, and I know that there is a lot to report out on it. But I did also want to highlight that we do have at the American Cancer Society our Center for Diversity in Cancer Research Training, which is a program focused on increasing diversity amongst those that are executing clinical trials and doing cancer research.
Excellent. Thank you so much for sharing that. Okay, so I think you actually covered all of our questions with the exception, I think Gary just put one in the last minute there for your program, which I'm assuming you mean Karen. Did you say you only have one navigator? And if so, is capacity an issue in terms of the number of patients that they're going to have to work with?
You know, we are learning. She is about to launch, and we're hoping that some of the processes can be automated. As I said, for example, all patients who respond affirmatively to the SDOH survey will get a bulk email response with some resources, and then they can follow up to get more, because we want to make sure to make it manageable, and we want her also to be able to reach out to those people who don't address it. So some ideas that I have is engaging medical residents in the work, having public health interns and social work interns from UC Berkeley in future work, and to really figure out how we can partner with other organizations. But that is going to be a challenge. And yes, right now at outpatient clinic, we have just one navigator, but she's working closely with the other social workers. And just to say that moving forward, any provider or nurse will be able to, this will be fully integrated into APEX. So any provider or nurse will be able to send patients resources. You'll be able to look it up, see what resources they were sent to, whether they were connected, and what happened with that. So one of the things that's going to be happening with this database is we're really diffusing the number of people who can do it. Now it's just social workers, but I think in the future, providers, nurses, anyone with APEX could be able to refer patients and easily find resources for individual patients through APEX, and it'll be automatically documented.
Great. All right, well, definitely trying to shift how we provide care and what the care delivery system looks like. And we look forward to hearing some updates about how things are going. So I want to just thank our speakers, Myrnelle and Heather and Karen, for sharing the resources that ACS has to support people with cancer, and also for leading this initiative to get navigation for health-related social needs, not just for clinical needs, integrated into our system. So thank you so much.